If you're a healthcare provider, you know exactly what we're talking about. It's that quiet, immense pressure that just builds up day after day, a kind of strain that honestly most people never see. I mean, this is what you do, right? You show up, you serve your community, you take what you have and you stretch it as far as it can possibly go. You are the backbone. But here's the thing. What if that strain you feel, what if it isn't on you? What if it's the system itself that's broken? Because that feeling of being stretched to the absolute limit, it's not just your clinic. It's not just your hospital. It's a reality all across the continent, and we've got the data to prove it. So let's actually look at what's happening. Okay, let's start in Nigeria. You've got private hospitals carrying a huge part of the load, but they're doing it while fighting a constant battle with not having enough staff and dealing with these huge gaps in basic infrastructure. It just slows everything down. Then you hop over to Kenya, and guess what? It's a similar story. Even when people can get to private care, they're hitting the exact same walls. Super long wait times, trouble just getting an appointment, and a system that feels completely disconnected. And in South Africa, the pressure is just overwhelming. Demand is soaring, and it's creating these massive queues and putting a huge strain on resources in both the public and private sectors. Finally, let's take a look at Ghana. You know, despite real efforts to improve things, delays in care just keep happening. And what's so telling is that the data shows it all points back to these system-wide bottlenecks, not the people working their hearts out. So, here's the big takeaway. It doesn't matter if we're talking about Nigeria, Kenya, South Africa, or Ghana. You see different countries, but it's the exact same pattern every single time. Workforce gaps, fragmented access, overloaded facilities, system bottlenecks. This isn't an individual problem, it's a system problem. Which brings us to the real source of all this strain. See, it's not the people, it's the blueprint. We are trying to meet the demands of today with a model that was built for yesterday. And I want to be really clear about this because it needs to be said. You are doing everything right. The problem is not your dedication, it's not your skill. The problem is that the very structure you're working in just hasn't kept up with what healthcare is today. And this slide right here, it just lays it all out, plain and simple. The old model, it was built around fixed hours. You had to physically be there. But today is about constant 24/7 demand, and people expect to get access right now. That old system is just crumbling under the weight. So the big question is, how do we fix this? And this is where we have to totally shift the conversation. Because we don't need to just add another layer onto a broken system. We need a whole new foundation. And that new foundation, it has a name. It's called AfriFarm Health. But it's so important to see it for what it is. Not just another product, but new infrastructure. And let's be clear on what that means. This isn't another app to download or another piece of software to learn. No way. Think of AfriFarm Health as the new roads and bridges for healthcare, a fundamental framework that changes how care itself actually moves. Okay, so how does this new infrastructure actually work? Let's get into the nuts and bolts of how it can completely restructure the flow of care. Well, it all works by connecting the dots. It takes what's already there and weaves it together through 5 integrated networks. It connects hospitals to pharmacies, to emergency responders, and then extends care into the virtual world and even into people's homes. It's like building a digital web that links everything together. And this is the key difference right here. Most tech solutions, they just add another complicated layer on top of everything. They digitize the same old problems. AfriFarm Health is designed to do the complete opposite. It's built to remove friction by changing how a patient literally moves through the system. And the result? Well, suddenly, care isn't tied down to one physical spot anymore. Patients can connect without having to stand in a line. Prescriptions can move from doctor to pharmacy seamlessly. Follow-ups can happen without another trip to the clinic. Those old bottlenecks, they just start to dissolve. And this is where it all comes together. We started this conversation talking about strain, but now we can talk about a new reality of strength. This is where the solution directly answers the problems we saw earlier. Just look at this. It's a one-to-one fix. For every single systemic problem, there's a direct structural solution. The problem of delayed access, solved with care that goes beyond a physical building. Fragmented services, fixed by actually connecting all the providers. Overloaded clinics, relieved by spreading out demand digitally. It's a complete redesign. And I really want to drive this point home. This is not about replacing anyone. It's about empowering the incredible experts who are already doing the work. It's the same dedicated providers serving the same communities. The only thing that changes is the system around them. And that right there gets to the heart of everything we've been talking about. Care almost never fails because people aren't trying hard enough. It fails when the system, a system designed for a totally different time, simply can't keep up with today. So I'll just leave you with this one question to think about. For so long, you've been working to support a system that's strained to its breaking point. What could you accomplish if, for the first time, the system was actually designed to support you?